Hi, Ellie.
I'm meeting Ellie at her synagogue, a place where she feels safe showing her religious identity. Unlike in our National Health Service.
It's become normalised to just be horrible and to be anti-Semitic towards Jewish people.
Ellie has a long-term health condition and has weekly hospital appointments, but in recent years has experienced a rise in anti-Semitism in the NHS.
I've seen nurses say really awful anti-Semitic things about Jewish people. I've seen hateful graffiti on the bathroom doors. I don't feel comfortable ordering any kosher meals that they might have available, or even that I'm Jewish, because I don't want to face any potential hate. And I don't feel I should have to do that, but I do because it's now become such a huge issue within the NHS.
A review has found evidence of the routine ostracism of Jewish people in the NHS. One Jewish staff member arrived at work to find his locker smeared with bacon fat. Some Jewish patients are reluctant to seek medical treatment, women even choosing not to have their babies at NHS hospitals. The report recommends mandatory anti-racism training for NHS bosses within 6 months, training on equality, diversity and human rights to be updated. And Lord Mann says NHS staff should not wear political badges or take part in political marches while wearing uniform.
In my view, it should be no big deal to give the Jewish community, Jewish staff, Jewish patients, an equal position, an equal service within the NHS. But it has to be done methodically, universally and quickly.
Earlier this week, we broadcast this, an NHS doctor packing up to leave the UK because of anti-Semitism.
If they are dying in A&E, I've been told by doctors that if they're from Israel, then they will not treat that person.
I spoke to Barak today from Israel.
It's been a very emotional week for me and my family.
This report comes too late for you as a British NHS doctor. Do you fear this report is too little too late?
For a long time, I think that Jewish healthcare workers have felt that their concerns really weren't fully recognised. And I believe this ship can be turned around. I would like to, and I intend to come back and work in the NHS.
But Ellie is more sceptical.
I feel unfortunately it's too late. It is too late to do anything about the crisis that we're in.
Well, let's get more from the author of the report, Lord Mann. Thank you very much for speaking to us today. Is there a danger in trying to solve a clearly very serious problem? You may have started to create many more. For example, you have left it up to the NHS to decide what counts as a political symbol. That could cause more division, could it?
I don't think it'll create division. I mean, it's not my role to be prescriptive in micromanaging the NHS. I've set quite a number of very granular, detailed recommendations, around 30 recommendations, to get the NHS back on the right course. And the right course is how the NHS used to be, which is not having politics and politicking interfering with staff relations or with patient care. And that's what's crept in. It's become a much bigger problem in recent times, and I consulted very, very widely across the Jewish community. What I found that was perhaps the most interesting, the most stunning to me, was how many people were prepared to tell me things that they were not going to go public about because not so much they were always scared, sometimes they were scared, but they don't want the target on them, their family, their children, especially families. And so the situation has been rather hidden away. This spotlights it. I also think it's quite straightforward with good leadership that the NHS can turn this round.
OK. Are you confident that your recommendations published today are not a knee-jerk reaction? They've been published relatively quickly and coincidentally in the same week where anti-racism training for police is under scrutiny.
Well, in fact, last October, I was given 6 weeks to do it, and I've taken 7-8 months. I've done it very methodically, very carefully, by talking across the NHS to the institutions and leaders of the NHS in great detail, but also in a very widespread way across the country to the Jewish community. So the government said 6 weeks. I told them very politely, no, this will take a lot longer. It has taken longer. So this hasn't been rushed. This has been carefully thought through
Lord Mann,
on how best to do this.
Lord Mann, if a doctor, if a nurse, if a midwife, if anybody treating somebody, and I mean treating them medically, clinically, because they are Jewish, if they are treating them differently because they are Jewish, is there anything in your report, in your recommendations, that would stop them?
Yes, as an example, if someone's lying on a hospital bed about to have an invasive procedure, let's say a camera inspecting them to check that they're okay, and you've got a doctor, a nurse and others around, if any of those people is wearing a political badge that they find threatening or offensive, then at the point of great vulnerability, when, say, someone's putting a camera down your throat to check out your health, possibly life-saving inspection, then that's incredibly disturbing.
No, I understand that. I understand
unnecessary.
what you're saying regarding that. But if somebody's racist and uses their racism to treat somebody differently, is anything going to change from what you've said? I just want to ask you one quick question.
Those people have no place in the NHS and they'll be sacked.
But we know that sometimes they do exist. The focus for a lot of the debate today has been around political symbols and removing them from the professional environment. What about if a member of staff has a tattoo on display that breaks the rules that you are proposing?
Well, I don't know if they've got a swastika tattoo and that's been shown. I imagine there's going to be quite an issue there. I think the problem that's I've looked at and seen and had evidence on, and lots of evidence, is about the use of political badges. And it's one of the 30 recommendations. There are 29 others there that I've made. It's an important one. I don't need my dentist to be wearing a Free Palestine badge or indeed an I Love Israel badge when they're about to drill my teeth. Thank you very much. And that kind of politicking is not how the NHS has built its strength over the decades, and it's not needed in the NHS. Keep your politics, whatever they are, whether I agree or disagree with you, keep your politics away from the workplace and away from the patient. That's one of the recommendations, and I think a very important one.